Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Let's get started. Hello, everyone. Welcome to another episode of True Wellness with Dr. D. I am pleased to be here today with Jeanine DiAngelo, who is, first of all, just amazing is the first word that comes to mind. She is so committed to people's health from a holistic perspective that it just shines through everything that she does. Jeanine is a holistic nutritionist, and she is a thermographer. She has come to find in her journey, and I'll let her share that with you, that thermography is very powerful and very insightful for people. And she's going to tell us all about her journey and what that has looked like and how she came to this place and what the heck is thermography.
Exactly. What is it? First of all, thank you so much for having me.
Oh, you're welcome.
And for the kind words, I'm so excited to be here. And I love to talk about thermography. So I'm excited to share with you, between the two of us, all our knowledge.
Yes.
Because you now have some really good knowledge on thermography as well. So we're going to chat it up.
Yeah. So Jeanine and I learned about Jeanine on Long Island.
Mm-hmm.
So she has a practice in Long Island, New Jersey, and North Carolina.
Yes.
And I know she has worked with our clients to do their thermography scans to reveal things that may not have been seen any other way. And so why don't you tell us a little bit, Jeanine, about your journey? Like, how did you go from nutrition to thermography?
Sure. So I have been a holistic nutritionist for, 20 years.
And you're still 21.
And I'm still 21. I don't know how that happened, but it did. And one of the things people would ask me all the time is, what do you do for prevention? And I kept responding with the same answer. I use thermography. I have used it on my own body for 20 years.
Mm-hmm.
And then it was like one of those aha moments in the middle of the night where I was like, why am I not adding this amazing preventative screening tool to my practice, to my toolbox of tools?
Yes.
So lo and behold, Better Body Thermography was born. It's been over 3 years. We now have 15 locations, like you mentioned. And it's just been an unbelievable journey. So we'll talk more about exactly what it is, but that's how that little baby was born.
Yeah. Well, what I love is like, sometimes people are like, is there a way to know if something is happening in my body before we start showing signs and symptoms and end up in crisis?
Yep.
And that is the beauty of thermography.
Right. So people often don't understand. I'm going to back up. So thermography is radiation-free, contactless, and painless. It has been around since the 50s. This is not new by any means. And it is FDA cleared for certain types of cancers, thyroid pathologies, and some other things. So speaking to how long it's been around kind of speaks to how important and how valid it still is.
Yes.
So we essentially take a heat map of the body to compare temperatures within. Okay. So, and back to your original statement, thermography has the ability to detect dis-ease, as I call it, 8 to 10 years ahead of traditional medical screening. The whole name of the game is prevention, just like what you do.
Yes.
So it's getting ahead of an issue before it becomes symptomatic, right? We don't want to be in pain and then have to back into that pain. We want to stay ahead of any type of issue through prevention.
Yes. Yeah. You know what I find so funny, Jeanine, is that a lot of people haven't even heard of thermography. Like they don't even know what it is or what it does. And one of the biggest areas that I think it's impactful for the entire body, but one of the biggest places where it always becomes a topic of conversation for me with my clients is especially when it comes to breasts, mammograms, breast cancer, all of that, because we are taught and we're told like, okay, after you pass a certain age, you need to go get your mammogram all the time. And inherently there are some risks in getting a mammogram.
100%. So here's what I always say to that. And I never understood it myself, which is why I sought out thermography, because the body is one.
Yes.
You treat the body as a whole.
Yes.
I treat the body as a whole.
Yes.
If we're only looking at breasts, whether it's a mammogram or a sonogram, we are literally disconnecting the breasts from the rest of the body.
Uh-huh.
How can we then see what else is going on in the body that may be affecting breast tissue?
Yeah.
Okay. So that's the most important thing, which is why I really tout full body prevention. For a baseline, you only need to do it once a year. You can come back and do breasts every 6 months, but your breasts are included in the full body. So we get a bigger picture of what might be going on with your thyroid, with your oral health. Big one, right?
Yes.
Lymphatic drainage, carotid artery. So I think that's super important. To speak about mammography, right? Everything has risks. Thermography actually does not have any risks. It's safe for children, men, nursing women, and pregnant women. With mammography, you do run the risk of some issues. It's radiation.
Yes.
It's compression on very sensitive and very important tissue in the body, which is your breast tissue.
And women complain about the pain of a mammography.
I have had women, honestly, come in tears, traumatized. Implants have been burst.
Oh my goodness.
Systemic cancer has been attributed to mammography.
Yeah.
So that is not ruled out. And also the thing you have to remember, and this is so important, is the false positive on mammography is so high.
Yes.
Which that means you're not really getting an accurate reading. And it leads to misdiagnosis and overdiagnosis. So what does that mean? That means they're telling you to have a biopsy when maybe you shouldn't have.
Yeah. And now we're interrupting and interfering with the
There you go.
There was that study. Did it come out last year?
About Sweden? Or
There was a study that recently came out. It was in the last year where they actually took the statistics of how many women were being overdiagnosed. And actually, again, like you said, like being treated. Like imagine having your breast removed when maybe there wasn't a reason to do that.
Right. And I see that. I'm telling you, it's probably the hardest part of my job is to see the women who have come in and have been totally mistreated by the medical model. They're missing a breast. They're missing 2 breasts. And then they say, I really should never have had my breast removed.
Yeah.
What do I do now?
Yes.
I mean, that is traumatic. It doesn't matter, at any age. So it's really important. I always tell people this. Ask questions, be your own advocate, do the work. There's tons of information out there, so it gets tricky.
Yes.
It's hard to navigate.
Yes. Yes.
Do the best you can and really I always say, use discernment. Like really sit with yourself and say, what feels right to me? Because if it doesn't feel right, it's not right.
Yeah.
Right?
Trust your inner voice.
Exactly. Just because someone comes in with a white coat and a stethoscope and maybe went to school a few years longer than you, doesn't mean they know your body. And it doesn't mean they care about your body.
Yes.
There's a time and a place for every modality, whether it's holistic, medical, whatever the case may be, but you're your own advocate. So you have to speak for yourself.
That's so true. I think we've forgotten that. I always joke with people. I'm like, you go to the doctor and you're called a patient. And why? Because you're patiently waiting to be fixed.
It's true. And again, prevention, this is my favorite line of all, and I use it in a lot of my marketing, is prevention is better than a cure.
Yes.
You will not need the cure if you stay in prevention.
Yeah. And that's, that's important because I want to point something out in that typically what we do in the conventional medical model is we call it prevention, but it's not really prevention, it's detection. It's not looking at things before they occur. It's
right.
like you go to the mammogram. The mammogram is not to say, oh, hey, you have some risk factors that can contribute to breast cancer. The mammogram there is to, quote unquote, detect breast cancer.
And ask yourself this. If you have to wait till you're 40 to have your breasts checked by this model, what then are all the women doing in their 20s and their 30s? And what should they be doing to look for prevention? How does that make any sense? By the time you're 40, the problem could be serious.
Yes. Yes.
If there is a problem, and said you lost all these years when you could have been removing toxins from your body, cleaning up the metal in your mouth,
yes,
draining your lymphatic system, all of that falls to the wayside because now you just didn't know and you waited until you were 40, and now here we are at 40 with some type of bigger problem that's going to require some type of bigger intervention.
Yes.
Right?
Yeah. And it's funny, it's people are always, in my practice, like in the functional medicine space, insurance doesn't cover the kind of care that we provide. Why? Because care that seeks to promote health, prevent disease, and promote and enhance the quality of your life is not considered medically necessary. It's all about detection. It's about pills and procedures, but not about that prevention. And what I love about thermography and while I recommend it a lot is because you're getting a glimpse of where those target areas in the body, what's happening so that you can begin that conversation. Part of the true wellness framework is questioning, right? Like, why is this happening? Oh, okay. So that's happening. Well, why is that happening? And it's about going down that pathway.
It's such a great point. And one of the things, which we'll talk more about, that one of the biggest things that thermography detects is inflammation. So as a doctor, as a functional medicine doctor, what is the root cause of all disease?
Inflammation.
Right. So how do we get the inflammation down? So we can see inflammation that you might not feel. You don't know it's there, but we're seeing it. It is creating a heat pattern in your body. We see subluxations in the spine. We can see varicosities, but this inflammation piece is the most important because that's the layer of the onion, right? That's your most important thing that can lead to, and usually does, disease.
Yes. Let's paint a picture here for our listeners. So when you have a thermography scan, you're getting basically a printout of the body with, it's thermography. So you're looking at all the different colors based on the heat patterns of the body, right?
Correct.
So looking at that picture, how does that give you an idea of where there's inflammation in the body?
Yeah, that's a great question. So because this is the camera I use is amazing. So note to everyone, make sure if you do it elsewhere, you ask about the quality of the camera, because just like anything, the quality of the equipment being used is very important. So I just want to put that out there. So what we do is we're taking a heat map of the body. We do, let's say we're doing a full body. We're going to do 29 images head to toe. It literally takes 30 minutes. And in that time frame, the images will get sent off. And we have 3 medical doctors and senior thermologists. So every report, every image thing I send in, every thermo, goes through 3 levels of interpretation.
Okay.
Very important to ask, too, who... There. Right?
Okay.
So that's a great question. So what happens is with thermography, and I usually tell people, think about thermal imaging, right? We're taking a temperature. So what we look for is something called, these heat patterns, these specific patterns, but important to note that red, when we see red, sometimes that's not always terrible. Sometimes seeing blue in certain areas of the body is not great either, because that's a circulatory issue. That means there's not a blood flow either getting to certain parts of the body, to your fingertips. But what we use is called delta T's, and it's going to show you temperatures of every different point and body part in the body. It is those temperatures that we use, and there's a threshold. So when something comes in that's above that threshold, that's where we wave a little flag. That doesn't mean there's this terrible thing happening. That means, hey, there's something going on here. We need to watch it. So we always look for these thresholds. And it'll say clearly on the report, right nipple is above the threshold. Left nipple is above the threshold. Again, some different factors come into play as far as those temperatures, which is why getting ahead of it and looking at this so early is so important. Because just because we see heat or we see above a threshold doesn't mean it can't be easily corrected.
Right. And the more earlier we see things, the sooner we can actually make a difference in it. And that's why this is such an important conversation. We're not waiting for the big issue to occur. We're looking to see, okay, well, what's the pattern so that things don't occur down the line.
And speaking of that, it just made me think of something that's really important. And you'll know what this is angioneogenesis is something that thermography picks up.
Yes.
Which is the blood flow that feeds a tumor. So a mammography does not see that. An ultrasound cannot see that. We can see a very specific heat pattern, and I've seen it. It's really sad and something to see, but also amazing because we can get ahead of that.
Right.
So you can literally see blood flow that will feed a tumor, which is why we are FDA cleared as an adjunctive screening tool to aid in the diagnosis of breast cancer.
Okay.
Very important. I've seen it in very young people who've had mammos and who have had sonos and that missed it.
Yes.
So again, prevention is the name of the game. I do 4-year-old children. You're never too young I did a little 7-year-old that had a thyroid issue, and the mom just had a feeling, and the doctors kept saying, nope, she's fine. Nope, she's fine. And the mom was like persistent. Finally found me, and sure enough, her thyroid came up hot on thermography. So, there's a lot of self-doubt. So people, this is why we say discernment. If you in your gut know something doesn't feel right, you're probably right.
Yes. Yeah. We've got to trust that inner voice. So talk to me a little bit about like the process. What is it like to actually have a thermography scan?
Yeah, also a great question, because people will come in and be like, where do I lay? I'm like, you don't.
No,
They're like, where's the machine? I'm like, there isn't one. So like we mentioned, it's just a very small state-of-the-art digital infrared camera.
Okay.
You come in, we're going to pretend it's you. So you're going to come in, I'm like, Dr. D, so happy to see you. You're going to get totally undressed. Because again, if we're doing just breasts, that's fine. I don't recommend that for your baseline, but we're going to pretend you're doing a full body. So you're going to come in, you're going to get undressed. We're in a closed room, a very safe space. In one of my locations, there'll be a privacy screen if you so choose to use it. It's very comfortable. And then the longest part of the exam is the acclimation period. And then people sometimes say, what does that mean? It means that I have to get your body temperature to match the temperature of the room.
Sure. Makes sense. You
Right?
want to make sure that you're looking at what you're actually looking at.
Exactly. So every room is between 68 and 72 degrees.
Okay.
Also important to note, there's a list of very simple protocols that you get when you book the appointment.
Okay.
As soon as you book that appointment, a link comes through saying, can't wait to meet you. Please be sure to follow these protocols, at least 48 hours. And they're very simple. It's, you don't want to work out the day of. You don't want to put deodorant on. You don't want to come in with a face full of makeup, because then I can't get an accurate reading on what's going on in your face.
Makes sense.
And a few other things, but they're nothing difficult. It just takes a little bit of prep. So you come in, you get acclimated, which is getting your body temperature to match the temperature of the room. That is literally the longest part of the exam. So you're standing while you're acclimating, but what we're doing is going through your intake. So it makes the time go by very quickly. I will also ask additional questions, because I've learned the master of the art of like extracting more information. So the more information I get, the better it is, because I add that all to the notes and then it gets sent off.
Okay.
30 minutes from head to toe. At that point, you leave. In 7 to 10 business days, you will get their report back.
Okay.
One of the big point of differences for Better Body Thermography is we shoot in gray inverse, and then those images get converted to rainbow. When you get the report back, you're getting both images, gray inverse and rainbow. And there are very different things we can see in both images. So you're actually getting double the images. So the report will be about 11 pages long.
Okay.
It's going to give you a full write-up by body part.
Yes.
In addition to all your images. Now, what I tell people, in addition to that, is included for what you pay to come see me, you get a call with the referring physician. These are senior thermologists. These are people that this is all they do.
Okay.
I use a company that every day and all day, they are doing thermology and thermography and interpretations. They're amazing. They're the best of the best. You get a 15-minute call, and they're going to walk you through that report.
Okay.
And tell you exactly what they see, and then they're going to give you little nuggets and suggestions of things you can do with your report. And I always recommend that report is yours to keep. You are then going to go show your own holistic practitioner or your chiropractor, because it's an additional tool that your practitioner can use to dig deeper into your wellness.
Yes. Yeah. It's kind of giving you the arrows. Hey, look here. Look here. Check this out over here.
Chiropractors love thermography. Acupuncturists love thermography. Massage therapists love thermography because it helps them dig deeper.
Yes. Yes. I love that. So let's talk a little bit about like, what are the important things? So I know you practice on Long Island and North Carolina, New Jersey. What do people look for if they're not in these areas?
So that's the beauty of this company. So if you're not in these areas, you can go to btiscan.com. We all use the same equipment. We all use the same referring physicians. And so the whole process is the same as you would get through me, but you would get it elsewhere. So btiscan.com, and then you're going to click on locations. We have 100 locations across the country.
Awesome.
It's pretty cool.
What's important, because I'm sure there is lots of thermography out there. What do you find are the most important things that people should look for? Like, is it camera quality? Like, what are those different things?
You want to ask about the process, because there is some differences in how people do it.
Okay.
I don't need to be the one, but I would always ask about about the camera, I would always ask about the process, and I would always ask about who's reading the reports.
Okay.
More sets of eyes is always better.
Yes.
And that background of those people who are reading the reports.
Okay.
It's important. It really is important. And then the quality, when I say about the camera, I've seen many other reports and have rethermoed several other people, and I've seen the quality of the reports. And when you get the report back, the report should be very thorough. We are a non-diagnostic tool, so it's never going to diagnose you. It's going to say things. This may be carotid artery insufficiency. This may be, etc. So you have to be mindful of that you're getting some great information based on what the report, how the report is generated.
Got it. Got it. Tell me some of the stories. Like, what are some of the things that you've come across in your years of doing thermography? What, I know that we've talked, and I've heard some of your stories about different things that women have identified. You spoke about the girl with the thyroid. Tell us some more of those stories.
I will tell you, because we talk a lot about women, but I will give you some stories because I do a lot of men.
Yes.
So the women bring back their husbands, which I love because that's them. They go through the process and they say, wow, this is amazing. And men don't take care of themselves the same way women do.
True.
So for men, it's equally as important. So I just had a man yesterday, as a matter of fact, for his second. He came back for his follow-up, which I love to see because he's diligent about his prevention. Some of the stories with men that you'll see, we do their breast just like we do women. Men do get breast cancer. But the big thing for men is testicular health. We actually will image their testicles.
Okay.
And they don't have to if they choose not to, but why would you come and do all this and not do a very important part of your body?
Right.
And one of the things we see with men is, some heat patterns in the testicles, which is cause for concern. In addition to estrogen dominance, there's a very specific pattern that shows up in thermography in gray inverse, and it's called mottling, M-O-T-T-L-I-N-G. And that may be hormonal imbalances or an estrogen dominance pattern. And I do see it often in men who work with, and women who work with chemicals, whether they're doing construction, whether they're painters, whether they're hairdressers and they're a colorist.
Right.
You might take a blood test, and that blood test isn't going to show you your estrogen levels because it's not above whatever their threshold is. Again, the beauty of thermography is it's going to show you something is uneven here. Another big thing we see, again, we can't totally diagnose it, but it's dehydration. It's these things where people are, they're systemic signs. So we can see certain signs that show like, wow, this person is probably very dehydrated. Again, if you're not hydrated properly, you're never going to reduce the inflammation. And we're going to talk about that in the end in my little nuggets. So those are some examples other than seeing some, upsetting things when you do identify breast cancer. We don't say anything in the thermo. I would never. That's why we use a very reputable company. That's their job. And then we kind of take it from there. I will guide anyone on their journey thereafter, whether it's a referral, depends on their financial situation.
Sure.
Who needs insurance, who doesn't, how compliant they're going to be. So once you have this report and you have your consultation, everyone is welcome to, and usually does, come back to me and ask me for next steps.
Yeah.
I refer them to you. I refer them out to a chiropractor. It just depends on what their need is and what their journey looks like to them.
Yes. Yes. So I find it really interesting because I love that you brought in that you also work with men, because men and women, we're all alive. We all have bodies. It doesn't make a difference whether we're male or female, right? But I think it's really interesting because we're just seeing so much of these hormonal imbalances in just the population in general.
Right. So here's what I'll say, right? Our soil is totally depleted.
Yes.
And that's just a fact. Our water is not nearly as clean as it should be, and our air is not nearly as clean.
Yes.
So we are in constant attack mode almost just by walking outside, just by breathing, just by eating food.
That's true.
Right? So again, how do you get ahead of that?
Yes.
Because those are things we can't necessarily control.
Right.
To a point, but we can't never go outside.
Don't live in a bubble.
And we can control that the soil is terrible and is over harvested and all the things. So we take supplements, we drink clean water, we get exercise, we keep air doctors in our homes, we mitigate our EMFs. Those are all the things. But again, self-care looks very different to everybody. But prevention is your most important self-care routine.
Absolutely.
Right?
Yeah. I always say, so when it comes for the stressors of the body, which are the physical, the chemical, even the emotional, all of it put together, right? We're not going to live in a bubble, but we certainly need to reduce what we can reduce, detoxify what we can detoxify, and build our body's resilience.
100%.
You know, and that's how we move down that pathway of better health.
And sadly, most people don't know how, or they're trying desperately. And sometimes it's so simple as hydration.
Yes.
Or meditation. Because the mind, as you know, the mind controls the body. And I do often see, to answer your original question, trauma, women with trauma. Male is right side, female is left side of the body. Fun fact. A lot of women with breast cancer on the right side have had trauma from a man, whether it's as a child, whether it's sexual abuse, a horrific divorce, whatever the case may be. The mind plays such a crucial role on your entire body. So
we neglect that. That's like one of those things that is neglected in the traditional medical paradigm.
Right, because we're always in fight or flight mode and we just go. But once you stop and listen and still the mind, it's going to tell you everything you need to know.
Yeah. And you're like, oh, wow.
Right.
And people are always surprised by these patterns, but we've lost that trust and faith that
it is. It's trust and faith. We lost trust and faith in our own selves.
Yes.
Which is unbelievable, right?
Yeah. We've got to get back to that.
That's what this is all about. Exactly.
Yeah.
It's so simple. It's getting back to basics. And I always tell my clients, less is more. Whatever it is, I don't care what it is, less is more.
Yes. Yeah. I love that. So talk to me a little bit about dental health, because I know this is something that shows up on those scans and people are not even in tune with.
No. So, and this is so interesting. And honestly, I know you and I have talked about this separately. It's one of, if not the biggest things I see. So I always talk to people and I say, do you know the importance of your mouth? And they're like, so number one, digestion starts in the mouth. We know this, right? So everything starts here. Your mouth, right, and all of this is 3 inches from your brain and 6 inches from your heart. Your heart. I'm also pointing to the wrong side. Your heart. So, So the what goes on in the mouth and what goes into your mouth and what goes on all here is so important. I've seen women with breast cancer that had root canals on the same side, dental implants on the same side.
Yes.
And people will say to me, Jeanine, I just had my teeth cleaned. I'm here to tell you, it does not matter.
Right.
Once the bacteria goes below a gum line, there is no such thing as a deep cleaning. It's traveling. It's on the move.
Oh, gosh. Yeah.
So we have this amazing system called the lymphatic system, right? That doesn't move on its own. We have to physically move it. So once it starts traveling through the lymphatic system, it can travel and land into a very sensitive and very delicate tissue, which is our breast. It also keeps moving. I've seen bacteria, in the abdomen area.
Yeah.
So it's so simple because what happens is we might want to identify it as toxins, although we can't say it for sure. My first line of defense is let's clean up your mouth.
Yes.
People have gotten their mercury removed, had teeth pulled because they didn't want the root canals anymore. So we'll pull that tooth. But it goes above and beyond that, right? It's oil pulling, it's lymphatic drainage, it's moving the bacteria from here, bringing it down and moving it out.
Yes.
Because those toxins have to go somewhere. If they stay in the breast tissue, that's a big point of that could lead to disease. Toxins lead to disease. So you'll go and have a mammo and they're like, we see something, and it throws you into a panic and they'll say, well, let's biopsy it. Now we're going to biopsy a toxin that is encapsulated. Now you're just going to explode it. So now where do those toxins go?
Everywhere else.
Everywhere else.
Yes, and that's the problem.
I always tell people, give yourself 90 days, unless, of course, it's extreme. Give yourself 90 days to clean up your body. Come back to me. We'll shoot just your breasts and we'll look at the difference. And more often than not, if someone's really diligent, it's amazing to see the difference because they put the work in.
Yeah. It takes that. It takes a little bit of effort, time that we're dedicating to ourselves for that self-care. It's not as important as Facebook or TikTok or
Instagram. And it really is simple. It's not that hard. It could be putting them on a drainage protocol.
Yes.
You jumping on a rebounder for 10 minutes a day.
Yes.
A little tripling.
I
know, it's my favorite thing. Yes. They're a lot of fun.
So let's talk about those things. So what are some of the key things, some key nuggets that you can give people just based upon your experience? What are the things that they can practically do to begin to move the dial with back to their health.
This is my favorite part. Because I always try to give people some information when they're with me so that they walk away with not only their thermography, but some like little nuggets. The simplest thing, and people sometimes don't know this either, what's breakfast? Breakfast is breaking fast. It's how you break fast from the night before. What is the best way to break fast? How are you going to wake up your organs in the morning? It's with water. Clean, filtered water. If you do nothing else for yourself throughout the course of the day, when you get up from bed, don't even let your feet hit the floor. You keep the water by your nightstand.
And you can't forget.
That you can't forget. It's room temperature. You sit up, you pray, you do whatever you do in the morning, and then you grab that glass of water and you drink it. You will be like a different person because now you just woke up your organs in the best way possible. It's great for bowel movement for people who are constipated.
Yes.
So important. So number one is hydration, but you have to have clean filtered water and avoid, and I'm sorry for whoever's not going to like this, avoid plastic bottles, please.
Yes.
Please. Get a glass container, get a stainless steel container, copper, anything but plastic. And no, Poland Springs is not your friend. So we need to talk about that. So that's number one. My second one? Oh, my second one is moving your body.
Oh, yes.
And again, it's whatever that looks like for you. Just because Dr. D does yoga and I'm a big weightlifter, that doesn't mean it has to be right for you. Get up and take a walk. Get on a little rebounder. Get a vibration plate. They're so affordable now. I got one for my kids for Christmas. And if you don't know what that is, it's a plate that you step on that literally moves your lymphatic system. They're $200. Ask for it for Christmas. 10 minutes a day, same thing. You will feel like you can run a marathon or climb a hill or whatever that looks like for you. So moving your body is super important because if we're going to do all these things, start detoxing, you have to push the toxins out. Right?
And the only way to do it is through that, right? Your heart's got, your circulatory system has your heart that pumps, your digestion's got the peristalsis, your lymphatic system needs you to move.
That's right. And then the last thing I would say is, obviously, as a nutritionist, is really bring mindfulness to when you're eating and what you're eating. I'm not a big fan of deprivation. I don't tell people, don't stop that or don't do this. Once you bring mindfulness to what you're eating, it's like next level. You start to say, oh, wow. Like when you're sitting down, I catch myself doing it. I'll eat at the counter real quick. Or it's, I'm eating fast. Once you stop and realize like what you're eating, how you're eating it, and when you're eating it, it'll take what you eat to the next level.
Yes. It's true. It's just being present.
It's just being present.
Yeah.
It's and that's also connecting the mind-body connection. And I will say one little other nugget. When you eat something that maybe isn't the best choice, pay attention to how your body feels 10 minutes after you ate it, 20 minutes after you ate it, and an hour after you ate it. Because you're going to be like, oh, I don't want, like, do you hit the wall? Does your blood sugar drop? All of those things. Again, easy fixes by just bringing awareness to what's on your plate and how you're eating it.
Yeah. I love that. I love that. Any other final words that you have for our audience?
I could talk forever, but I know I am grateful for this opportunity. And I tell people all the time, if anyone has questions, I am always accessible via email, via, cell phone, through my website. And then we can kind of go from there.
Absolutely. Love it. Thank you so much for sharing your knowledge and your wisdom and your expertise and really helping us to expand our awareness and what is out there to allow us to really take care of ourselves at a whole other level. So with that, everyone, we thank you for being here and we'll see you on the next episode of True Wellness with Dr. D. Bye, everyone.
Bye.
This is Dr. D. reminding you to tune into your body, reconnect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Let's keep redefining wellness and empowering change together. See you next Thursday for the next episode drop.